Climate change and public health are connected in numerous ways. We can consider the direct impacts of climate change, such as heat illness during a heat wave, exposure to floodwaters, injury resulting from a severe storm, or a rise in mosquito or tick-borne illnesses following a mild winter. Climate change also affects the social and environmental conditions that contribute to long-term health outcomes, such as access to healthy foods, air and water quality, job security, and stable housing. Climate change does not affect all people equally and can exacerbate existing health inequities by worsening communities' exposure to poor environmental conditions and further depriving them of health-promoting resources. Our mental and physical health, our financial resources, and social connectedness strongly influence our vulnerability to climate impacts. When considered together, many strategies to prevent and adapt to climate change can also offer huge health benefits while ensuring resilient and healthy communities into the future. By evaluating climate risks through the social determinants of health, Plymouth can prioritize actions so that all residents, workers, and business owners have the opportunities for good health, minimize risk, and greater ability to adapt in the face of our changing climate. For example, the present public health crisis has heightened awareness of the unique value of our natural resources to our mental health. Our ability to safely get outdoors depends strongly on the continued health of those resources. This poster provides some highlights from health data from Plymouth County and, where available, Town of Plymouth. Respiratory health. Climate change worsens respiratory health by increasing air pollution, extending the ragweed season and also the amount of pollen, and by worsening indoor mold growth. Children are at higher risk as their respiratory system is still developing. While Plymouth has lower rates of pediatric asthma when compared to the state, it is important to recognize that there are large racial disparities in the incidence of asthma. Physical activity. 86% of Town of Plymouth residents live within a 10-minute walk of a park. Despite this, nearly a quarter of Plymouth County residents are physically inactive. Plymouth focus group participants suggested that poor cycling and pedestrian access to areas for recreation as a possible reason for low levels of physical activity. Food insecurity is more common among low-income residents and is a key contributor to chronic diseases like diabetes. 9% of Plymouth County residents are food insecure. Climate change threatens to disrupt global food production. For example, local cranberry growers listed warming bog water and the declining frequency of frosts as challenges for their industry. Mental health. In its 2019 Community Health Needs Assessment, BID Plymouth identified mental health and substance use as the region's most pressing health issues, which have a profound impact on individuals, families, and communities. Access to behavioral health services is extremely limited in the region. This is particularly true for those with limited English, different cultural perspectives, recent immigrants, racial ethnic minorities, and the LGBTQ population. The Town of Plymouth has the second highest rate of mental health inpatient discharges within the hospital service area. The report also cited data which indicates 103 opioid-related deaths between 2014 and 2018. On the positive side, crime rates have been slowly declining across the county over a similar period. Extreme weather events are associated with the worsening of various mental health conditions, and people with mental health are also more vulnerable to climate change, as some medications worsen people's sensitivity to extreme heat. Lastly, people with disabilities experience higher rates of illness, injuries, or death during extreme weather events. Limited mobility can also increase the risk of isolation, a risk factor for heat illness. With an increase in older Plymouth residents, the community will need to ensure an ability to communicate with and respond to the needs of older residents during extreme weather events.